Our next friend, our next neighbor, was elected in 1998 to serve in the 9th Congressional District after serving 8 years in the Illinois State General Assembly. She was responsible for provisions in the Affordable Care Act law to require improved review of insurance company premiums, nursing home quality protections, and initiative to increase the number of health care providers. And she recently introduced a deficit reduction bill that reduces the income inequality in Illinois by taxing millionaires and billionaires. She is the Chief Deputy Whip in the House Democratic leadership. She is a genuine shero to the progressive movement. Ladies and gentlemen, welcome our friend, our sister, Congresswoman Jan Schakowsky.
No, I'm actually here to thank you. You know, sometimes in Washington, we think we're at the center of the universe, but actually, it was a grassroots effort. It was the work of Citizen Action and all the groups that have been involved in this that actually made it happen. And what a day it was. I will never forget that day. March 23rd, when the president signed the legislation into law, I wept. Of course, you have to understand, I cry at commercials. But anyway, this time it was so genuine because I look around this room and up on this stage, people had been fighting for so long. Not the last 100 years, maybe, but sometimes it feels like that, in order to get this legislation passed. And it was, I think, the most important thing about that day is that the Congress of the United States of America declared that health care is a right and not a privilege. You know, I actually, for so many years in my little bio, it says that, and her top priority is to make sure that there's affordable, quality health care for all Americans. And now, I had to change my bio and say, she played a role in passing legislation that will provide quality. What a moment. What a moment that was. So I'm so appreciative of you, and I have to tell you that others made a different decision the day that passed, and their decision was that they were going to go out and tell lies about the legislation. They were going to say no to health care for all Americans, and they were going to work as hard as they can to repeal the bill, not to fix it, but to repeal the bill. And so we have had amendment after amendment and bill after bill in the House of Representatives that would take away health care from Americans. But I want to tell you, I think the tide is turning. I feel a new narrative sweeping across the country, starting with a prairie fire that began in Wisconsin and is now going to change America. And yes, it does tie into the fact that one of the things that people demand now is not just the right to organize. It is about protecting our values as a country, protecting the American dream, protecting the middle class that has been, there's been a war against the middle class for so long that we're mad as hell and we're not going to take it anymore, and we're going to defend this health care bill and make sure that it's not repealed. So raise your hand or give me a shout out if you're a woman. Let me hear you. Well, you know, finally, under this legislation, being a woman is no longer a pre-existing condition. The discrimination against women is actually going to be ended. Raise your hand or give a shout out if you're living with a disability or a pre-existing condition. All right. You know, you don't get to be a ripe old age without something. on your record. And no longer will they be able to discriminate. Already, children, and in 2014, adults. Raise your hand or holler if you're on Medicare. Woo, 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 woo. And, you know, all the terrible lies that have been spread about Medicare, making seniors fearful. I mean, you know, it's like elder abuse, really. Going around and telling things that are not true, that we, in fact, have made Medicare better. And here's what their plan is. They would like to turn Medicare into a voucher program and send all older people and people with disabilities out with a little amount of money and say, you go look for health insurance. We are going to defend Medicare as one of the centers of our values in this country. This is a good thing. We have to stick up for it. We need to stick up for it. So I could go on, and William did, you know, to shout out if you're a small business, or shout out if you're a child or a parent, or to shout out if you know someone who wants to receive value for their premium dollars, because everyone will benefit from this legislation. Oh, except for maybe the insurance companies who try and gouge us every day. And I want to thank Mike McGrath, our insurance commissioner here in the state of Illinois, for working with me and all the state people who are working to pass legislation to make sure that Illinois can actually modify rates that are excessive in our state, just what we want. I want to do at the federal level too. So we are sending a message today that we love Obamacare. We love Obamacare. I predict they are using it as an epithet, as almost like a four-letter word against this health care bill. But I believe that it will not be long in the future that members of Congress and all of us will be wearing buttons that say, I love Obamacare, because it will deliver for the people of America. So thank you very much for being there. Keep on fighting. We're going to win it all the way.